Dear students, welcome to GAME, Gross and Microscopy Explained. I hope at least one of the two pictures on either side is familiar to you. A gross picture. Can you identify this particular structure? Good. It is a gallbladder with gallstones. It is an important question in the enclosure given within. This is a mounted specimen of the gallbladder. It measures so many centimeters long. Generally, a sac-like structure is not given in a 3-dimension, but in length. Also, we should mention what is the thickness of the wall. The external surface is grayish white or grayish black, whatever it might be. And the internal surface, that is the inner mucosal surface that we can see, we should mention the color. I have given it as brownish pink. You people can alter it according to your specimen. And it has got multiple calculi of varying sizes. So this one is extremely large, whereas this is small. They are almost filling in. And this region is called the neck of the bladder, and that is also being stuck with a large stone, precipitating the surgery. This is another specimen. Multiple pale brownish stones or calculi are seen. Each of these, that is the stones, measure so many centimeters in diameter. The stones have a faceted edge. Faceted means almost flattened. They say that by constantly rubbing against each other, they produce a faceted or a diamond-like edge. The inner surface of the mucosa is pale pinkish brown, and the thickness is hardly about 1 to 2 millimeters. The external surface is darker brown in color. A third specimen. This I have pertinently given for you to compare. This is a cholecystectomy specimen or a specimen of the gallbladder measuring so many centimeters long. The wall is about 2 to 3 millimeters and it has got multiple calculi, some of which are very small, hardly 2 to 3 millimeters, whereas some are more than 1.5 centimeters in diameter. The color is brown and it has got a faceted edge. This is a pouch. There are different kinds of containers. One is a pouch or a bag that an old lady carries for keeping her cash. It has got exactly this kind of an appearance, so it is described so, sac-like. This is a microscopic picture of the normal gallbladder in which the mucosa is thrown into folds. It is lined by simple columnar epithelium as is shown in the enclosure. Lower down, there can be mucous glands, and these are the longitudinal and the cross sections of the muscular fibers. Mucosa, folds, mucous glands, muscular bundles. This is a slide of a chronic cholecystitis, and the source is given over here. In this, I am finding again the mucosa is thrown into folds. It is lined by columnar epithelium, and if you observe carefully, there are multiple fine small dots throughout the lamina propria or the mucosa. So these indicate inflammation. But more important is I found that there is a diverticulum that is going deep inside, and it is open only at one end here, whereas the other end is blind. Hence it is called a sinus. And this sinus has been given a proper name, the Rokitansky-Aschoff of sinus, a classical hallmark of chronic cholecystitis. This is yet another slide. I find the mucosa thrown into folds lined by columnar epithelium, lot of inflammatory cells, lymphocytes predominantly. And here also I am finding a Rokitansky-Aschoff sinus. So what are the points in favor of your diagnosis? Undulating mucosa, lymphocytic infiltrate, Rokitansky-Aschoff sinus, and congestion of the blood vessels. See you in game 34.